We're now live on YouTube.
Thank you, Leah. Good evening, everyone, and welcome to the Cabinet meeting of Broadland District Council on the 20th of April 2021. Just to let you know and to remind you, this is a public meeting which is being live streamed on the Council's YouTube channel. So I would remind you to follow the usual etiquette around remote meetings. To be more specifically, if you can mute your microphones to avoid the background noises, unless you're actually invited to speak. If you wish to speak, again, as usual, if you can just raise your hand to indicate, and if I spot you, I'll bring you in. If I fail to spot you, then James or Leah will tell me, and then I'll bring you in. If we can do that, that would be good. Okay, so moving on to declarations of interest. Does anyone have any declarations of interest to declare?
Would you like me to conduct a roll call, Chairman?
Yep, can do that now as well, if you want.
Yeah, Councillor Copplestone.
Yep, let's do that with, so if there's any declaration of interest and also to confirm that you're here, please. Sorry, James, go on.
Councillor Copplestone.
Present, no declarations, thank you.
Councillor Emsall.
Present, nothing to declare.
Councillor Hempsall.
Present, nothing to declare.
Councillor J. Leggett.
Present, no declarations.
Councillor Mancini Boyle.
Present, no declarations.
Councillor Vincent.
Present and no declarations.
And Councillor Wymark.
Present, no declarations.
And I see that there are some other members present. There's Councillor Adams.
Present, no declarations.
Councillor Brennan.
Yeah, present, no declarations.
And Councillor Riley.
Present, no declarations.
Thank you. I think that's all the members present.
James, sorry, Councillor Morrell.
Councillor Morrell, sorry, I've missed him.
Present, no declarations.
Thank you.
Okay, is there anyone else lurking out there that we've missed? Doesn't sound like it. Okay, thank you for that, James. Okay, so moving on then to apologies for absence. So there aren't any because we're all here. So that moves us on then to the minutes on page 6 of the previous Cabinet meeting on Tuesday, the 16th of March. I'll take those minutes on block. So if there's anything that needs updating, changing, deleting, adding, if you could let me know. Okay, so there's nothing. So on that basis, I will take it that those minutes are okay to sign. If you can just show by raising your hands that you approve that.
It's unanimous, Chairman.
Thank you. Okay, so that moves us on then to item 5, which is public speaking. And I believe we have someone joining us who wishes to speak. Good evening.
Good evening.
Good evening, Eleanor. Sorry, it's just waiting for it to settle down for you. I understand you wish to speak to the Cabinet members tonight on the Broadland meeting?
Yes, please, on item 13.
Okay, so we will invite you to speak, and you have 3 minutes as a time scale to sort of work to. So I'll hand over to you and give you your opportunity to let us know whatever you want to let us know.
Okay, thank you very much. Well, good evening and thank you for allowing me to speak at this meeting. I've got a short statement to make and following that a question. So this is with reference to item 13 on the agenda, which is on page 87. So the Norfolk Strategic Planning Framework has come up with some sound guidance for how to address climate change in local development plans in Norfolk. It includes a new section 8 and agreement 19, which are supported by at least 18 papers produced by the project team. However, as stated in agreement 19, the GNDP councils who are signatories to the document have agreed to delay implementing the proposals until the review of the GNLP, which is at least 5 years away. Experts responding to the recent GNLP consultation have raised concerns about the lack of policies on low carbon construction, low energy homes, renewable energy, and the quantum and spatial distribution of the housing that's proposed. There is a legal duty for local plans to have climate mitigation policies under the Planning and Compulsory Purchase Act 2004. A failure to do so undermines the soundness of the plan and could therefore make it open to legal challenge. If the NSPF was implemented now and its guidance was incorporated into the GNLP before its public examination this autumn, millions of tonnes of CO2 emissions could be saved over the period of the plan. So my question is, would the Cabinet be willing to request to the GNDP, as a GNDP member council, that the draft GNLP is reviewed against the new NSPF strategic guidance to address climate change? Thank you.
Okay, so thank you for bringing that point up. And as you know, and for everybody, climate is very important for us all. So, Lana, did you want to say anything at this point in time?
Well, Chairman, I suggest that we perhaps discuss this lengthy point. It would have been helpful to have this in writing to us prior to Cabinet so that we could have had a sensible response back, but we can raise this while we discuss the agenda item, Chairman, I suggest.
Okay, so we'll cover it at point 13, item 13. Yep.
Yeah.
Okay. Again, thank you for raising that and talking through your thoughts and views on that. So, okay, so moving on to item 6. So representation from non-cabinet members. There are some non-cabinet members here, so if you wish to speak on any relevant item, please let me know. And if appropriate and time allows, because we've got a big agenda tonight, I will endeavour to bring you in at the appropriate time. Moving on to Overview and Scrutiny Committee. Steve, is there anything you want to introduce at this point as chair of ONS, or do you want to do it as we go through?
Yeah, and I'm well aware, Chair, you've got a heavy agenda here that was reflected at ONS. So the reports and recommendations are as they are in the minutes, apart from variance on a recommendation to by ONS, which is on members' IT. So when we get to that, I'd like the opportunity to speak to the recommendation that ONS is putting to you tonight. Thank you, Chair. Okay, so that would be item 14, yeah? Yeah, 14, yeah. Okay, thank you for that, Steve. Okay, so that moves us on then to item 8, Service Improvement and Efficiency Committee at page 21 to receive those minutes. Jonathan?
If we receive those minutes, the items are covered on the Cabinet agenda. Okay, thank you for that. So we'll receive those minutes. Moving on then to item 9, which is the Environmental Excellence Policy Panel Development. Oh, interesting. I thought it was just the Environmental Excellence Panel, but just reading my note here. Okay, so Judy, are you picking this one up?
Yes, thank you, Chairman. I don't want to add anything other than to say that the environmental coordinator has now been appointed and should start in mid-May, something we're very much looking forward to. Thank you.
Oh, thank you, Judy. That's really good news. We've been waiting a while for that person to come on board, so that's good. Okay, so moving. Oh, sorry. So we'll receive those minutes. So thank you for that. So moving on then to item 10, which is the COVID-19 recovery plan, page 33. Is this with you, Jamie, or is this with Rodney? Who's kicking off?
Chair, I think I'll kick off if that's okay, and I'm sure Rodney will say a few words.
That's
if I forget.
fine then, Jamie. Please do.
Thank you, Chairman, and good afternoon, councillors. Lovely to see you all. So this report is attempting to do three things. One is looking to give Cabinet an overview of where we are in terms of our ongoing response to the ongoing demands of the pandemic. There's a really excellent infographic from page 45 onwards in your packs that gives some sense as to the amount of work that's gone on across various functions, departments of the council throughout the pandemic, but also the report gives you a bit of an overview of where we are in terms of the actual pandemic itself, the numbers that are presenting themselves. And as councillors will be aware, we've come out of the latest set of restrictions and the latest wave. The second purpose of the report is to give an update to Cabinet on where we are against a COVID recovery plan that was written and endorsed last summer, June, July time by Cabinet, obviously written at a point in time of our understanding of the pandemic coming out of the first wave. And not necessarily knowing what was coming after that, but the report gives a progress update against the various actions that we undertook to make progress again, some of which you will see have been completed, some of which are ongoing, and some of which are yet to be started and will feature in our delivery plan. The third purpose of the report is to provide a bit of a summary position in terms of the various funding streams. As councillors will well be aware, we've been bequeathed numerous different funding streams through the COVID experience, some directly from central government, others via other sources, including Norfolk County Council. It is confusing, and hopefully this report seeks to give a bit of clarity in terms of both what we've received, what we've in the past discussed allocating money towards as part of our endeavours to respond to the pandemic and the needs of our communities and businesses, and also what we have left, and then will form part of our consideration of a next phase of a recovery plan in the next cabinet in June is, I think, what we're aiming for. You know, as part of that, we tried to be quite specific about how we would see the allocations of the Containing Outbreak Management Fund, which is one of the sources of funding given to us via Norfolk County Council's Public Health Department, but recognising that, as we have seen throughout the pandemic itself, there's a degree of fluidity required in terms of how we respond and what we spend our time focusing upon. So, Chair, I think that's by way of an intro of what the report is seeking to achieve. I'm sure Rodney will want to add a couple of words to that too, but then after that, happy to take any questions.
Okay, thank you, Jamie, for your summary there. Rodney, is there anything you want to add at this point?
Thank you, Chair. I just think I'd like to point out a couple of key recommendations in this report. So very much with the unring-fenced COVID monies, obviously in paragraph 6.9 on page 40, that's where we identify there's potentially up to nearly £900,000 worth of funding available to help support the recovery over the coming months and potentially years. And we've got a request in this report to actually release some of that, to actually provide some additional resource to the council tax and recovery teams, because we've seen a significant increase in the workload in that area. It's increased demand, and very much people having more complex needs, because actually we're having to support them and help them make sure we can have affordable payment plans in place for the people who are struggling due to the pandemic. And the second point I think just like to highlight is regarding the conf money. The recommendation very much is asking you to actually give your approval to actually agree for a delegation so that we can spend some of this money as and when the need arises before we come back to the next meeting in June. So very much we're asking for a delegation to the relevant director in consultation with the relevant portfolio holder if we want to spend some of these conf funds in line with the activities that are listed in this report. But that was all I wanted to add to the report. Thank you, Chair.
Thank you for that, Rodney. Trudy, is there anything you want to pick up at this point?
Yeah, thank you, Chair. Just really to repeat what both Jamie and Rodney have said, I mean, I'll look forward to the report coming in June, where we look at the wider allocation of the funds. And I understand since this paper came forward, we've actually received some more conf money as well. So I'm assuming that will be looked at at the same time. And like we've said, the table on page 43 is a suggestion at the moment of how the money could be spent. So it's just really for Cabinet to authorise releasing of that money. And with regards to the council tax, there has obviously been, as Rodney has said, there's been far more complex cases taking up far more time with officers to come up with the correct repayment plans. And also we've not been able to do the normal work we would have done with regards to court cases and so on. So there is a lot of backlog. So this is again a temporary 2 posts for 18-month period. And so I'm quite happy to put forward the recommendations on page 44, item 10, items 1 to 4. And just to repeat, the last recommendation is agree a delegation to the relevant director in consultation with the relevant portfolio holder and the portfolio holder for finance. And that will be to authorise the release of the comp funds to support activities and projects listed in the report. Thank you.
Okay, thank you for that, Trudy. Are there any questions that Cabinet members have for Trudy or Jamie or Rodney? Judy?
Thank you, Chair. Just for absolute clarity, the delegation would refer to those items on page 43.
Correct.
That's right. Just to add that I fully support them for the activities within my portfolio holding.
Okay, thank you, Judy, and thank you, Trudy, for clarifying that that's how that will work. Any other questions for anybody? Jonathan and then Fran?
Just a quick question on clarity. In the ONS minutes, the options were 1 to 5. Where am I looking at the wrong section? But I saw that the options were for the COVID were 1 to 5. Just for clarity, am I missing something?
I don't know. The recommendations on the Cabinet papers are certainly 1 to 4. There isn't a 5.
As far as I can recollect, if it helps, Chairman, they were 1 to 4. I don't know if Steve can confirm that as well, but I can't recollect that there was ever a 5th option.
Yeah.
I mean, we've just had the sort of papers that you're considering now exactly the same. So I don't think there was ever an option 5, Jonathan.
Yeah.
Okay.
Yeah, just to confirm,
just to confirm, there actually were 5 options on there, but I believe there was a 1 to 5. If I look at your minutes, Steve.
Yeah.
On the draft minutes the pages aren't numbered, but it's covered in item 256. But I believe you'll find that item 5 has been incorporated. I'm guessing that's what Fran is about to confirm. Fran.
Exactly.
Yeah, thank you, Chairman.
Exactly
yeah, thank you. I was just going to say exactly that in the table before us, as you say, the £47,000 for a young person's mental health support worker is incorporated here in the paper, which is why we don't need to have a separate point. Obviously, as I think in ONS it was actually missed off the paper.
Yeah.
So I think that's all it was really. I just wanted to comment really that how pleased I am to see so much additional support being put in place for people who have fallen into difficulties and people who are vulnerable and need that additional support at this time, obviously because of the impact of COVID. So from my perspective and my portfolio, which is almost all of them really, it's very comforting to see that we're actually taking the stance to support the well-being of our residents. Thank you.
Okay, thank you for that, Fran. Yeah, from my point of view, it's really useful to see all of the things that have gone on since we last agreed this back in July to be listed out in this way. So that's appreciated, Jamie, your team, and Rodney, so that we can see what's happening. Obviously, the next step is moving forward with the Containment Outbreak Management Fund and making sure that that's prioritised and allocated out so that it can be spent. The table there shows a whole host of range of activities that hopefully will have a significant impact on local residents and help them with their difficulties or challenges that they face at that point in time, but also to enable the council to function and some of the things that it needs to do around trying to make the area safer as we move forward with the changes and the alterations in the different key points in the roadmap. So thank you for that. In the absence of anything else, James, I guess we need to do a roll call on
Yes,
the
Chairman.
recommendations. So Trudy has put forward the 4 recommendations there. So if I can ask you to do the roll call, James.
Certainly. Councillor Copplestone.
4.
Councillor Emsall.
4.
Councillor Hempsall.
4.
Councillor Leggett.
4.
Councillor Mancini Boyle.
4.
Councillor Vincent.
4.
And Councillor Wymark.
4.
That's carried unanimously, Chairman.
Thank you, James. Okay, so moving on then to item 11, starting at page 72, social prescribing. Good evening, Kerry. Are you leading on this one?
I am, yeah. Good evening.
So
Thank
I'll
you.
hand over to you.
Thank you. Good evening, everybody. This paper, whilst connected very much so to the previous paper because it's talking about the conf, it has been brought separately just because of the longer term implications and the opportunity for members to hear a little bit more about social prescribing and what our plans are as a council to become more involved in that. So if you'll welcome me to do so, I'll just give a quick overview of what this means and why we've come separately with it. For those of you who aren't aware, and I appreciate I have bored some of you in the past with talk about what social prescribing is. Social prescribing is a national initiative. It's all about using community-based welfare support for those who are perhaps accessing the NHS for that support incorrectly. You'll, I'm sure, be aware that when problems occur in a person's life, often that is shown through medical need, whether that be treatment for anxiety or stress. Equally, people just go to the GP surgery because they have welfare issues that really should be dealt with in a community setting. So social prescribing provides a service within GP settings that is not medical, but it helps to tackle some of those issues that mean somebody is presenting at a GP surgery. So over the past few years, it's gone from barely known at all to being a real a huge wave across the nation where social prescribing is popping up all over the place. And we do have a service for social prescribing right across Norfolk. And in Broadland at present, that's delivered by the voluntary sector. It's our aspiration and hopefully one that's shared to be able to deliver that service within Broadland using our own staff that we hope to seek funding for in the future. It's a complicated picture, complex is an understatement perhaps, but the funding cycles mean that at present it's not possible for us to currently seek NHS funding to deliver that in Broadland. But the next opportunity for us to do that would mean that from the financial year beginning April 2022, so that the forthcoming financial year, we would be able to, and we feel fairly confident we would be successful in receiving funding from the NHS to deliver social prescribing across Broadland. We are already in discussions with NHS partners about that. So the reason we've come today is to talk about the community connector model, which is what we would seek to utilise to deliver our social prescribing service, and looking at using our containing outbreak management fund to pay for 2 members of staff to act as community connectors for the next year. That gives us an opportunity not only to showcase what we can do and how we can support people, but actually starts to deal with some of those issues we know are there now, both because of COVID and in spite of COVID, for want of a better phrase. So we have a really successful help hub model. We also know that that could be enhanced by using community connectors whose role is to be out and about in the community, get to know what's going on and deal with customers on a one-to-one basis to deal with their issues early. Early is really, really key. And to utilise community facilities and community provision to help them to manage those difficulties that they might be having. We know that community connectors are, and this kind of role has a huge impact on preventing problems escalating to more high level support services that we might provide. So our plan is, if members are in agreement, that we have a year to have the community connectors in post to assist with the development of our hub model, to continue to embed that within our communities, with the long-term aim to seek funding from the NHS to both continue and expand on that model. At all times, members of our community all across Broadland would be able to access the services of a community connector, whether or not they're also based in a GP surgery. This will always be open to all, and it's just something which will benefit everybody, in summary. So this is not a request at all for the community connectors to become part of core funding. It's an opportunity for members hopefully to understand that we have a plan moving forward for it always to be an externally funded service. I hope that clarifies everything that I've been asked in the past, and if there's any questions, that'd be great.
Okay, thank you for that, Kerry. Fran, did you want to add to that?
Yes, thank you, Chairman. Yeah, I mean, as Kerry has said, you know, this isn't just something that we've thought up here. This is a national project which has proved really fruitful in supporting people, and I think it's about early intervention and prevention more than anything, really. As Kerry said, so many times when people go to the GP, it's because that's what you do when you're unwell. But what's driving that physical difficulty or mental health difficulty, it's what's behind that, and often it's something which is actually quite easily fixed with a little bit of support. You know, it may well be due to financial difficulties, it could be to do with housing issues, but you know, these people can go back around and again and again and again. You know, for instance, going back to the GP saying that they've got, you know, a chest infection. Well, that the chest infection is the symptom, but the actual real cause is the fact that they've got damp in their flat. You know, now we can work with them to resolve that as a housing issue. So I think it's an excellent thing which we should be going forward with. I wanted to ask Kerry a couple of questions just for clarity. All right. On page 75, it says that we have already been selected as the lead provider in the NHS Eastern region for the National Academy of Social Prescribing. So what does that mean when we're getting to the competitive bidding in before 2022, obviously going forward?
Yeah, so apologies if this has caused any confusion. So because it is a bit of a strange one. So when we got that position last year, go back a step, the National Association of Social Prescribing has been set up because social prescribing has developed into such a phenomena across the country. The National Association of Social Prescribing set up different areas across the country, and what they were looking for were people who were experienced in working in social prescribing that could help others learn from what they do. We felt as a one team officer core that we had that experience based on what we'd done in South Norfolk with developing social prescribing there. Luckily, the Association of Social Prescribing agreed, and we were successful in getting that post, which means that Julie Ringer is currently on secondment to a post working for NASP, and she's able to get huge amounts of information about how social prescribing works all over the place. She's developed huge amounts of skills, but equally she's been able to share how we've managed to do an awful lot of stuff in a really positive way in Norfolk. So that's what that is. It was just hopefully a way for members to see that we've got a lot of experience already within the team from other pieces of work that we've done around social prescribing, and that's felt on a national basis. One thing I forgot to mention was our involvement with the NHS in developing their model around social prescribing, and the influence we were able to have there, which now we know fits really well for Norfolk. So yeah, you can't shut us up on a national level around social prescribing, it's safe to say.
Thank you. Chairman, can I just come back and ask a couple of other questions?
You said you had a few more, Fran.
Yes, thank you. Okay. I just wanted to know how we are looking to target these two people, because I mean, I might be wrong, and you can tell me if I am wrong, but I would wonder how we can actually cover the whole of Broadland with 2 people, and perhaps how we may need more. And if you can sort of give us an idea of how many realistically you think would be, able to do a fantastic job rather than just scratch the surface a bit.
Yeah, so two is a start point. I think it's safe to say the aspiration would certainly be to have more. There are formulas that are utilised across the country as to how many social prescribers might be appropriate per number of patients in a surgery. Off the top of my head, I'm not 100% what that is, but it's certainly more than 2 across the whole district. In terms of focusing their work in the short term, what we would seek to do is look at where we get referrals into the hub as it is, see where people understand that service is available, and then target those areas that they're not coming from and just inform people what's there, get out into that community and learn what's going on, and see whether there's any barriers as to why. I've always said until we put the help hub on the ad break in Coronation Street, not everybody will know about it. And the community connectors are there as a sort of lower budget version of that, really. They'll go out and they'll speak to people and they'll explain what's there and what support is available and work with people on a one-to-one basis. But it would certainly be an aspiration that across the year, alongside the community connectors, we would have a comprehensive communications plan, which would mean that we can get information out there to people to explain what support is available. So though they might not physically see that community connector, they know they're there and can contact them by other means.
Thank you.
Okay. Had enough, Fran? Do you have any more questions?
I could carry on if you wish, Chairman. I mean, obviously the next item we're talking about breathing space, and I'm sure that the community connectors would help support people with that. And also, obviously, we talked about the recovery teams. There'd be an impact there, and obviously you already mentioned the help hub. So I think the community connectors could have an impact in so many areas, and hopefully take some pressure off of some of our other teams. So that would be my hope in the short term, and obviously the longer term, as we look to expand this service and give it the people that we need. But I'll stop there, because I could carry on, but we'll have got a lot on the agenda. So,
okay, yeah, I think as you've alluded to there are other things that interweave with this. So Judy, you wanted to come in?
Yeah, thank you, Chairman. I just wanted to ask about 3 questions, if I may. Is there any way that your 2 connectors would be able to utilise the group of volunteers that clearly are already working in Broadland and paid for by the NHS, if I've understood that correctly? Do the connectors, we talked about people in debt, but do the connectors actually identify groups of people? And I was thinking particularly of those people who use our food banks, and to work with them to make sure they've got enough, they can claim as many grants as they need, or benefits, I should say. And is this going to be monitored and evaluated, or do you feel that, as you've already said, that you're recognised as, you're well recognised within the sector, that that's not necessary? Thank you.
You couldn't have asked 3 more brilliant questions, because they highlight the really good bits about the connectors, I think. So in answer to your first question around volunteers, a massive part of the work of the community connector is to understand all of those volunteers and all of the voluntary groups that exist and hook into them as much as possible. So you'll be aware that during COVID, we've seen an upsurge in use of and existence of what we call mutual aid groups, people helping each other out. The community connectors are to be hugely connected in with those, to understand what they can provide for customers when they see them and they identify needs. Equally, they are also really aware and really knowledgeable of local volunteer groups that exist for a whole plethora of other things, whether that be knitter natters or mother and toddler groups or men's sheds. So the community connectors relationship with volunteers is at the heart of what they're doing, to put it mildly. Community connectors identifying groups, again, exactly what they're all about. So when somebody is using a food bank, it's really hoped that where there's a community connector present in that area, that the food bank's really aware of them and is able to direct somebody to speak to the connector to see what other issues there are that can be helped with, and look at that kind of wider picture. If somebody's at a food bank, I'm pretty sure there's other issues there as well. And to use an awful phrase, a connector is kind of a jack of all trades. They're there to understand the plethora of stuff that is available to that person and direct them to the right service. So again, really, really important. And in terms of monitoring and evaluation, if I had a project that wasn't always monitored and evaluated, I don't think I should be doing this job. So we would always be looking at what the connectors are doing, how could they be improved, where do they stand in kind of locally, the benchmarking locally, nationally. 100% they will always be looking at this and seeing how we can do better.
Thank you very much.
Okay, thank you for that. Fran, you want to come back in?
Yeah, thank you, Chairman. Yeah, I just wanted to move. I didn't see anyone else's hand coming up, so I thought I'd move the recommendations as they are on page 77, 8.1 as it stands. I'd like to make an amendment to 8.2, so it would actually read to agree to recruit 2 full-time equivalents on a 12-month contract with the intention to review in 6 months' time to evaluate the benefit to residents of the community connectors and then carry on the sentence as part of setting the 2022/23 budget. Thank you.
Okay.
So that means we have a review in 6 months' time to see how they're working, what the benefits are, and obviously then we should have an idea, I guess, with the funding cycles of where we are and whether we need to put it into any budget in the future.
Absolutely.
Yeah, so
thank you.
Does that give enough time, Kerry, for you to get a feel for whether it's working or not?
Jamie's just made a wonderful suggestion, perhaps 6 months from when they commence. So let's see how long it takes me to get them in post, and then we'll go from there. That would be wonderful.
Yeah. No,
Thank you, Jamie.
Yeah, that's fair enough. Yeah, I'm happy to. We can change that to review in 6 months' time from when they commence.
So six months and a day we'll be here, but yeah, we'll see.
Okay, lovely.
Does that give you enough time to evaluate the impact that they're having on a positive?
Yeah, I think we need to be in a position where we're really on top of how they're doing, because, like you said, we are into a competitive process around bidding for funding from the NHS. So we need to be evaluating it from day dot, really. So absolutely, we will come to members with a good evaluation of where we are and what we see happening next.
Okay. And I assume we'll be looking to put a bid in later this year, then, will we, for 22, 23?
We're already trying.
We're already trying.
We're already having those conversations. That's for sure. We're paving the way early.
Okay, no, that's good to hear. Judy, you had your hand up.
I was only going to say I was happy to second Fran's proposal if you needed a seconder.
Okay, thank you for seconding it. So, as I can't see anyone else indicating they want to speak, I'll move on. We have a proposer and a second of the recommendations, 8.1 and 8.2. On page 77, as amended. James, do you want to just confirm you've got the amendment for 8.2?
I think I have, Chairman. Yes, it's to agree to recruit 2 full-time employees on a 12-month contract with the intention to review in 6 months' time to evaluate the benefits of Community Connect. So 6 months' time from when they commence in post to evaluate the benefits of community connectors as part of setting the 2022-23 budget.
Yeah, that sounds
that's okay.
What Fran said, yeah, is that right, Fran?
Yeah, I did put benefit to residents, but
benefit
I mean, it's obviously clear it's to the residents. It's not going to be for anyone else.
Okay. Well, there actually are wider benefits, I believe, because it does mean earlier intervention deals with demand elsewhere in the system. So it just moves it around a bit, if I've understood things correctly.
It could well do, yeah. So, excellent.
Okay. So, James, back to a roll call.
Yes, Chairman. Councillor Copplestone, are you in favour of?
4, please. Thank you.
Councillor Empsall?
4.
Councillor Hempsall?
4.
Councillor Leggett,
4.
Councillor Mancini Boyle,
4.
Councillor Vincent,
4.
and Councillor Wymark.
4.
That's unanimous, Chairman. It's carried.
Okay, thank you for that, James. Okay, so that moves us on then to item 12, starting at page 78, which is the debt respite scheme, breathing space and mental health crisis moratorium. I'm not quite sure who's presenting this one. Is this
That's Christian Cubitt, Chairman.
Oh, okay, Christian Cubitt. Sorry, I can't see Kristen. Is he there? Oh, yeah. No, I can see a hand now. Yep.
Thank
That's
you.
all these little windows looking at me. So, good evening, Kristen. Over to you.
Thank you. Yeah. So, breathing space regulations are coming in on the 4th of May as a result of a Conservative manifesto commitment from 2017, and they aim to help people in problem debt access better debt advice and give them time to find solutions. So this will also be followed by the statutory debt repayment plan as well, which will surely follow it. So the impact assessment for this predicts that the take-up is going to be around 800,000 cases in the first year, and that's going to rise year on year. So that translates to approximately 15 a day for us. Each of these cases are going to require quite a bit of manual intervention. We're going to have to search across all of our systems for any debts that the person owes. We're going to need to put holds on their debts, and we're going to need to put holds on with any enforcement agents and things like that as well. So there's going to be a lot of administration work come out of it, but moreover as well, it's going to bring to our attention a lot of people or a lot of additional people that we're not already aware of that require extra support. We're already finding in the recovery team that the cases are getting complex at the moment because of the pandemic, and this is going to bring to light a lot more cases that require our support. We, as was mentioned a little while ago, work closely with the Help Hub and Benefits team to make sure we're finding the right solutions for people in debt when they contact us for help. And it's really important that we can respond to this legislative requirement properly and in a timely manner, and also continue to provide that support for the people we already do as well. So the recovery team at the moment, we only have 4 full-time equivalents covering both councils. We're finding we're already a bit stretched with the increase in work from COVID, and the increase in work from breathing space and the statutory debt repayment plan we think is going to be quite significant. So we're asking for an extra person for 18 months initially to allow us to make sure we're prepared to deal with this and assess what the impact truly is when it comes in on the 4th of May going forward.
Okay, so thank you for that, Kristen. Trudy, did you want to say anything more?
Yeah, just quickly, thank you, Chair. Thank you for the report, Christian. As you said, this is statutory, so this has had to come forward now. As a council, we do have to comply with this, but obviously we want to comply with it. We want to help residents as much as possible. And we can see that this is going to take up an awful lot of time. And although it's statutory, unfortunately, central government haven't come forward with any funding to help with this. So it is the responsibility of the council. Now, 18 months to see how we go, I think is fair enough. We maybe could look at it a little bit quicker, perhaps 12 months down the line or something, to see how we're getting on, and see if we're going to need to put something more permanent in place than just temporary. So I think it's worth perhaps reviewing it before the 18 months is up, just to see what we actually need to do. And just a bit of a question for Rodney, actually. Although this is obviously new legislation, it is clearly going to be exasperated by COVID. I wondered if we could look at some of the unring-fenced COVID monies towards this first 18 months, if that's at all possible. Thank you.
Okay, thank you for that, Trudy. I guess that's something for you to have a look at, Rodney, unless you can
Now,
answer it now.
Now, if I can respond, please. Yes, so you're right in that although they are slightly separate issues, as in this, it's not directly related to COVID. COVID has put extra pressure on the team, and therefore it would be acceptable to actually charge this additional sort of resource to COVID, because actually some of that pressure will be coming from the additional pressures due to COVID.
Thank you for that. In that case, then I'd like to recommend on page 83, item 8.1, but perhaps add in reviewing it after 12 months to see how we go, how the team are doing, to see if we're going to need to put anything much more permanent in. Thank you.
Okay, thank you for that, Trudy. I'm assuming, I mean, the numbers look large. I'm assuming if the team get swamped and this becomes too difficult, it will come back to us with a plea for help for more. Yes, I'm getting some nods, so that's okay.
Yes. I can assure you of that. Or if necessary, we will come back to you, but hopefully it won't be necessary.
Yeah, no, that's good to know. Okay, so any questions for Trudy or Christian or Rodney? No, can't see any. Okay, so we have the recommendation before us, 8.1 on page 83. Over to you, James, to do the roll call.
Yes, Chairman. Councillor Copplestone, are you in favour of the proposal?
For, please, James.
Councillor Hempsel, sorry.
For.
Councillor Hempsel.
For.
Councillor Leggett.
For.
Councillor Mancini-Boyle.
For.
Councillor Vincent.
For.
And Councillor Wymark.
For.
That's carried unanimously as amended, Chairman.
Thank you, James. Okay, so that moves us on then to item 13 on page 87, the endorsement of the Norfolk Strategic Planning Framework update. I'm looking for Paul and I can't see him. Does that mean you're doing it, Phil or Helen? Ah, I can see Helen. Helen, I can see Helen, yes. Over to you, Helen.
Thank you, Chair, and good evening, everybody. So the paper before you is an update, as Councillor Vincent has already said, to the Norfolk Strategic Planning Framework. This is a key document that we have endorsed. It's the third iteration. We first signed up to this in 2018, with the last signed version in 2019. As a local planning authority, we have a legal responsibility to engage strategically across boundary matters, and the NSPF provides that structure. It is a key role in the planning process and shows we are meeting our statutory obligation known as the duty to cooperate, and in strategic policy terms, maintaining a statement of common ground. It is prepared under the Norfolk Strategic Planning Member Forum, and for Broadland, it is Councillor Hempsel who sits on that board, on that forum. Paragraph 3.2 outlines the proposed key changes to the current version, to ensure it is up to date, and those key changes relate to reflecting on the National Planning Policy Framework updates, the COVID Economy Recovery Plan, changes to the Health Agreement, and also, as mentioned earlier by the speaker, the climate change. These are already reflected in the next version of our Greater Norwich Local Plan, and it's these agreed shared objectives and strategic priorities which are set out, which are designed to improve the outcomes for Norfolk as a whole and inform the preparation of future local plans. With respect to climate change, I will just address that because the Greater Norwich Local Plan does have a chapter that we've already endorsed the Reg 19 version of the plan to be submitted. Not to be submitted, but to go out to consultation, which is looking at whether or not we have fulfilled our duty to cooperate, which we feel we have. So we have been legally looking at making sure that is compliant. There is a specific policy relating to that needs to be taken into account, but I think the key is the next iteration of the local plan process will actually make sure we are sound and are actually providing our obligations under the planning and Compulsory Purchase Act to make sure we are compliant on soundness in relating to climate change. So that will be fully tested as part of the next stage. But as far as what we're looking to do today is to endorse the next version of the Norfolk Strategic Planning Framework. And if you've got any questions, I'm obviously here to answer those for you. Thank you, Chair.
Thank you for that, Helen. Lana, is there anything you want to add?
Yes, Chairman, thank you very much. I'd just like to draw members' attention to pages 89 and 90, where the key amendments and changes and new agreements have been outlined, as well as climate change. We're addressing issues that have been really topical at this council, which is older people's accommodation, rollout of broadband, which I know that the economic development portfolio holder has been very much in favour of and really supportive of. As well as the new green infrastructure agreement, which we're still discussing, which is the best way to put it forward. There's huge sections on climate change, coastal erosion, which these are Norfolk-wide issues that are all covered in there. So the updates are significant and very positive. As the council's representative on the forum, we've worked very hard and very proactively together to ensure this document and this duty to cooperate is not just print on paper. It's actually something that's very much live in Norfolk and something that we really engage in. So I'd like to move to Cabinet that we endorse this document and continue to recommend to Council that we endorse this document and continue our cooperation with this forum, at least for the next financial year. New legislation might come into place where this forum may not be required under the Localism Act. However, I really hope that we can continue this cooperation in some shape or form, because nothing other than real wins have come out of our working together. So thank you, Chairman.
Thank you for that, Lana. Thank you for recommending that. I'd agree with your sentiment there exactly, that councils working together across Norfolk has got to deliver a better outcome than us all working in isolation. So, okay, so any
Chairman,
questions?
could I just briefly,
go on, Lana.
Could I just briefly touch upon the question that was put to us earlier? I feel that the member of public actually endorses this document and is really supportive of us being supportive of it. The question itself, I suspect, is more of a late Greater Norwich Local Plan consultation response. So I suggest that we treat it accordingly and address it accordingly. With your agreement, Chairman.
Okay, thank you for that, Lana. I guess I'd look across to Helen to see whether it can be treated as a element of consultation response or whether it's actually too late for that.
If comments haven't already been made as a result of the Reg 19 process, then we can't add additional comments now. However, it is going to be something I'm sure that will be tested through the next stage in relation to this chapter within the local plan. So if comments haven't already been made, it will be a chapter that the inspector will be looking at very closely in any event in relation to making sure we have not only adhered to our duty to cooperate, but we are actually complying with the latest guidance in the National Planning Policy Framework as well. So it should all be covered as part of the next stage of the plan process.
Okay, I think when Elena mentioned it earlier, she did make comment that it had been raised as a consultation response. So hopefully it has and will be picked up in that way then. Okay, are there any questions on the strategic planning framework for Helen? No? Oh, you're going to get off lightly tonight, Helen. Okay. Right, well then we'll move on to the recommendation, which is there. So, James, do we need to do a roll call for this one?
Yes, Chairman. Councillor Copplestone, are you for the proposal?
For, please, James. Thanks.
Councillor Empsall?
For.
Councillor Hempsall?
For. James, did we have a second?
I took it that Councillor Empsall...
Councillor Vincent did. Okay, good. Yeah. Okay, for.
Councillor Leggett?
For.
Councillor Mancini-Boyle?
For.
Councillor Vincent?
4.
And Councillor Wymark.
4.
It's carried unanimously, Chairman.
Thank you for that, James. Okay, so that moves us on then to item 14, member IT, starting at page 224. Is this you this evening, Emma?
It is me, Chairman. Here we go again. So, member IT, I think we've all talked about this quite a lot. So, the Service Improvement and Efficiency Committee had the results back from the member survey. So many thanks to everybody that filled those in. That was really, really helpful. So they went through the summary of the findings, and what the report is telling you at section 3 is the majority of the frustrations and the issues that we found that members are coming across is in terms of the software that's on the iPads that you currently have. So the rollout of Office 365 and the move across to that new software suite, we're confident with the training will absolutely take away a lot of those software issues that came out through that survey. So we're quite confident that will address a lot of those, but obviously we will need to touch base on that and make sure that carries on in that way. In terms of the hardware issues, there are a couple of those noted at section 3.4. So what we provided the SEAC committee with were some options for them to look at and determine, based on all the information that they've got, what do they believe is the best option going forward. So 3.8, they had the option of iPads remaining the preferred solution. 3.9 was to move to laptops as the preferred solution, and 3.10 was in relation to members just using their own equipment. One of the things that the committee talked about, well, a few of the things that they talked about was absolutely the software and the training that we need to provide for members to help with a lot of those issues. They also talked around the length of life of those iPads. We're 2 years into a 4-year product. So we would be, if we moved away from the iPads, the committee were quite aware that actually that would be a dead cost, for want of a better expression. So they were mindful of that when making the decision. There was a lot of discussion at the Service Improvement and Efficiency Committee, and on a roll call, we saw 5 members voting for option A, which was the iPads, 3 for laptops, and there was 1 abstention. So the recommendation from SEAC onto Cabinet is that they keep the current provision of iPads for the next 2 years. This was then also discussed at overview and scrutiny last week, and I won't speak for Steve. I'm sure Steve will provide a summary for you. But a couple of the key points that came out of that discussion, I'm just looking at the minutes, was to just make it clear that that current provision is for the next 2 years, and to then hold a full review of member IT prior to the next election, so that we can absolutely make sure that when the new members come in, we're providing them with the right equipment from everything that we hopefully will have learned over the next couple of years. And overview and scrutiny also asked for Cabinet to agree that the final decision on member IT was be made at Council. As you're aware, this is a Cabinet decision, so it would be for Cabinet to determine if they wanted to give that delegation away. I will leave it there, Chairman.
Okay, thank you for that, Emma. Thank you for taking us through the report. Jonathan, anything you want to add?
No, I think the report, there's a lot of information in there. We have had a lot of input from the members regarding the members' IT. We are seeing a lot of changes now happening in the next couple of months, which we hope we're going to allay some of the problems that have been faced. So I think the data that we've got there from the members was very good. I will obviously put the recommendations forward, but I don't know if you want to take questions from anybody else first.
Okay, I'll do that. Again, just like to thank Emma and the team for going through what's been quite a painful process. But nevertheless, it's been necessary for us to understand through the workshops and through the survey the impact that having the right software and tools to do the roles the members have, and how important that is. So Lana, you indicated you wanted to come in.
Yes, please, Chairman. Again, I'd like to congratulate both Jonathan and Emma for bringing this to us in this way. We have to remember that ultimately we're spending public money on IT for members, it's important to keep the costs down and just to get the most cost-effective product and outcome as we possibly can. So, you know, there's a balancing act between, you know, between what the, you know, super duper Rolls-Royce requirements would be and actually having a sensible, workable outcome and product that we can all use that allows us to do our jobs properly. So thank you both.
Okay, thank you for that, Lana. Is there any other questions from Cabinet members? No. Steve, you wanted to come back in at this point?
Thank you, Chair. Yeah, well, as you see, there's two recommendations there from ONS. Just before I move on to those, when you look at the surveys that was done, there's a clear indication that there are far more members, it was 14, etc., that were dissatisfied with the iPad. And it's not just a software issue, it's actually the functionality of them in terms of, you know, you can't print from them and a whole range of things, and they're a very small device, actually typing documents in, etc. And there was a preference for laptops. However, going through the SIEC committee minutes, etc., you can see there was a drive and a push forward to make use of the current iPad provision because that's already been paid for and it is in place. There was also another point put forward that the Cabinet, of course, had set aside some of money which was excess, which actually paid for the officers' rollout of laptops. And there was another sum of money put aside as well from the same pot. So in terms of the budget, there wouldn't be an issue if laptops were provided. It's the same pot that provided the extra laptops for the officers. However, at the end of the day, we've got the two recommendations. On the first one, the Cabinet approved the recommendation from SEC to retain the current provision of iPads for the next 2 years and to hold a full review of member IT provision by October 2022. The key reason why that came up, and we clarified it with Emma, as she's already said, is that if the review is not done 6 months beforehand, kit has to be bought, purchased ahead of May in that following year when the elections are due and when we have new members taking on their functions. And of course, that's when the end of the iPads run out. So you need to do a review prior to that to then know what to purchase, if the iPads have been okay, know in actual fact we need to move to something else, and costings, etc. So it's a sensible recommendation there in terms of that review. Emma's also concurred with that at the meeting. And on the second point, at the end of the day, it's all the members that have to use this kit, and therefore it was felt quite important that as us as members, being the users in this regard, that we should also have a say on that finally via a full council meeting for members to determine. And therefore we're also asking Cabinet to defer their position on this and to, in the final analysis, enable the full council to make that final decision after the 6 months, after the review in October 2022, of course. And that's about it, Chair. Thank you.
Okay, thank you for that, Steve. My own feeling on some of those things is a little different to yours, I guess. I don't think you quite summarised the summary in the report in the way that most people are interpreting it. It certainly wasn't the outcome of the workshops that the issue was the iPads. The issue was definitely the software and the training that members had received that meant they had a shortfall in the delivery and usage of that piece of kit. But as I say, more importantly, I think I'm not prepared to wait 18 months for a review. I don't see any point waiting 18 months for this to come back round. And I would expect this to be reviewed relatively quickly following the 365 rollout. After all, how do we know whether it's working or not? I don't think we can wait 18 months with members being stuck or unable to use their kit, or with kit that doesn't do what it's supposed to do. And while I appreciate your comments around cost, again, it comes back to members should have the kit that they need to do the role that they do and fulfill that role. And it's important that we make that choice around the right kit to do that. So again, if the kit needs changing sooner, then the kit will be changed sooner. If the kit we've got is appropriate, then that will run its life and then be changed at the appropriate point. It's my feeling on that. I see there's quite a few others that want to comment. Okay, so Trudy, you wanted to come in?
Yeah, just an observation really, and just a bit of disappointment. We've got cabinet papers here full of items helping our residents, and the only comment we've got from ONS is on something that helps members, and I think that is seriously disappointing. And with regards to the money that was put aside, I remember at the time it was put aside, the 35,000, in case it was needed, and that's what it always said in the recommendation. And at this point in time, the conclusion is that we don't need it. But I just think some focus on residents would be a really welcome change from ONS. Thank you.
Thank you, Trudy. Okay, so Jonathan, did you want to come back in at that point?
Yeah, well, I was just going to say that I have seen the points raised by over scrutiny, and yes, I feel like you that we should be having a constant review of the members' IT, if you know what I mean, not waiting until just 6 months before and then saying what do we need to do 6 months before. So yeah, I agree as well with that there will be more talk before that, as opposed to waiting that long before we do anything. Another point, which is something to note, is the fact that you can print from an iPad. It's not the iPad that's the issue, it's the printer that you have. So some printers you can print from an iPad to a printer, but it's not the iPad, it's the printer that's at fault there. So again, more training for members to know what sort of printers would be better for them to buy.
Yeah, I think we can probably pick up in through the training and the questions that people ask through the training that's being rolled out. So, okay, anything else, Jonathan? Did you want to put forward the recommendation?
Yeah, I can do. Have you got anybody else to speak?
No. Oh, looks like Lana wants to come in. Lana? No, you're shaking your head. Okay, so back to you.
Not speak. I was going to
sorry.
second. That's all.
Okay, so Jonathan needs to recommend it first. So back to Jonathan.
Chair, can I also clarify points about the
Steve? Can you wait? Steve, you've had your say, please.
Right, yes, it's in relation to what Trudy said. It's just not factually correct. She's not factually correct.
Steve, please stop talking over me.
I've asked you if I can come in again.
And the answer's no.
Fine. So therefore, we'll deal with this back on ONS. Because she's not factually correct.
Steve, thank you. Jonathan.
Right. I would like to put the recommendations forward. I would like to put that the Cabinet approve the recommendation from the Service Improvement and Efficiency Committee to retain the current provision of iPads, with a review in July covering the Office 365 rollout and training undertaken by members, with another member survey and member workshop to enable officers to have information on software improvements to report back at September Cabinet.
Okay, thank you for that, Jonathan. So there's probably quite a lot there. James is probably still writing that down. Do you want that repeated again, James?
For me to get down, Chairman, but I will make sure that I get it down.
Shall I ask Jonathan to do it again and slower?
If you would, please.
Yeah, Jonathan, if you could just for James so we can get it written down properly for you.
Yeah, and the second one is with a review in July covering the Office 365 rollout and training undertaken by members, with another member survey and member workshop to enable officers to have information on the software improvements to report back at September Cabinet.
Okay, thank you for that, Jonathan. And Lana, does that meet with your earlier seconding? Yeah, you're nodding. Okay, so Emma, I just need to check with you to see if that's doable within the timeframes of your team and what they're doing and the resources and all of those aspects. Obviously, you can see we're quite anxious to ensure that the learning from the rollout 365 is understood from a positive point of view, because we expect it to be very positive. Obviously, if there is some other things that we can do, then we would hope they'd be picked up quite early in the process.
Yeah, so I absolutely get the need for a review in a timely manner. My only nervousness, being completely honest with the July review, is we will be in the middle of the Office 365 rollout still for officers and staff, so that our time will be very focused on them. And I don't want to promise something knowing that I've got that going on at the same time. If I could have a little bit of grace, maybe the cabinet after September, we would probably do service and improvement committee first onto cabinet. But if I could push it back a little bit, you can ask me when that is, aren't you? Hold on, get me a bit of paper. It would just give me the time to make sure we do this properly. So if we did service and improvement committee,
I think
we could do an extra one, but
yeah, I think the concern Jonathan's got is relates to if there are issues and it's not going well. Obviously, we don't really want to wait until October for that understanding to come forward.
Yeah, I absolutely understand that. I'm just flagging it is a lot that we're going to need to manage, because we are obviously doing a rollout to 700 staff as well during that same time, and I wouldn't want to promise something and I would then be here saying, actually, could I come back in October cabinet? So if we were to do the survey and start doing that in July, but aim to bring something back to October cabinet, but if there's anything major, then address it as we work through. I just don't want to overpromise on this one, Chairman, knowing how close it is to everybody's heart.
Okay, I guess I'm looking back at you, Jonathan. It's
well, I mean, don't want to
to a certain extent, if it pushes back, it pushes back. There's a problem, obviously, is how far back it gets pushed, and perhaps we should go with the dates you've suggested.
If we look at the fact that the members will be April, May, so then we should have 6 months of using it so that when the survey and things can come out in July, we should be able to pick up any of the issues. Obviously, what we're hoping is that members then have some positive things to say in the surveys, and when they come back, then Emma can just come back in sort of September and report that everything has gone really well and all the members are a lot happier. So with that, if that is the case, I'm not looking for a massive report in September. We're just looking to say that, yes, we've reviewed what has been going on and do it like that. So yeah, if there is a problem with the timescales due to the fact that obviously the staff and everything are also having the rollout, I think if there was a problem, we would need to hear about it earlier. But if that was all, all going well, then I guess that would be okay to have it put back a month, where we can obviously look at that, which might then give the officers chance to put in some comments about how the rollout has gone for the staff team as well. So I'm not, if obviously if we look at September, but obviously we could always do it in October if we needed to. Okay,
Trevor, you've got your hand up. Would you like to come in?
Yeah, Chairman, if I can just endorse what said, if we can, because don't forget you've got August in the middle there when lots of people will be away. So if we were able to get your endorsement to aim for October, but if we can get it earlier, bring it earlier, but rather overachieve than disappoint. And I think with August in the middle there in particular, so October is probably realistic. But if we can get it to September, then we'll surprise and amaze you rather than disappoint you by pushing it back, if that's okay.
Okay, with you, Jonathan, you've had two pleas.
Yeah, no, that's okay. Then we'll do that. Then we'll change it to the October, and obviously then we can then bring it forward if needed. I had forgotten about the August period, and that will be where we're asking members to also fill in surveys. The speed at which the members return the surveys to the team is something that we do also have to consider. So obviously, there's no point in the team looking at half the information. We really want as much information from members as possible, and that would also be affected by them being on holiday, I guess.
I'm sure if they have a problem, they'll find a way of responding. So you'd be surprised how quickly they can do that when needs must. Okay, so James, are you okay with that amendment from September to October?
Yes, I'll be able to decide for that in the end.
Yep. Okay, so Trevor, I saw your hand went back up.
Chairman, I need to say thank you for your forbearance.
That's glad we're all working on the same page. It's good. Okay, so we have the recommendation as amended from Jonathan and seconded by Lana. So over to you to do the roll call, James.
Yes, Chairman. Councillor Copplestone. Are you for
For, please, James. For. Thank you.
Councillor Emsall.
For.
Councillor Hempsall.
For, and just for completeness, I'm happy with the change of the timetable. Thank you.
Councillor Leggett.
For.
Councillor Mancini-Boyle.
For.
Councillor Vincent.
For.
And Councillor Wymark.
For.
And that's carried unanimously, Chairman.
Thank you for that. Thank you for that, James. Just like to pick up the point that was made around Cabinet deferring a decision back to Council. Obviously, the Cabinet will make that choice should any such decision come before it to do. But I would like to remind Steve that we do have a delegation system that works for a reason, so that appropriate decisions are made in the appropriate places. And I guess as a comparison, we're not asking all 700 staff to vote on which particular type of laptop or IT kit or screen that they want. We're providing them with the right tool to do the job that they want to do. And in the same way with members, when we look at that point in time, then members will be provided with the appropriate kit to do the appropriate job at that point in time, with the decision being taken at the appropriate place, as with all decisions as we move forward. So I'd just like to pick up that one. Okay, so moving on, that moves on to item 15, which is the review of policies. And I can't see what page that's on. That starts at page 232. I need a clue here. Who's doing the presenting of this one for me?
That would be me, Chair.
Oh, Rodney, you got this one. Okay, Rodney.
Thank you much, Chair. As you'll all be aware, it's important to make sure we do have good policies, particularly cover things like our anti-fraud, our money laundering and whistleblowing policies. So very much we've taken the opportunity to review and update these. So these matters have been considered by the Audit Committee on the 11th of March, and they were approved by the Audit Committee. However, the Audit Committee reports direct into full council, so we thought it was good practice to bring these in front of yourselves as the executive, again to give you the opportunity to review and comment on these before they're taken to full council later this year. But that was all I was going to say on the matter. Thank you, Chair.
Okay, thank you for that, Rodney. Is there anything you want to add to that, Trudy?
No, just to say, obviously, Audit have done all the work on this. So I'd like to thank Councillor Nurden as Chair of Audit for this. And I'm very happy to put forward the recommendations 7.1 on page 234. Thank you.
Okay, thank you for that. Are there any questions for anyone on the policies? Judy?
Thank you, Chair. I'd just like to ask about training and training for members. Is there a training course for members on these very interesting policies at all?
Okay, is that full with you, Emma?
Yeah, that falls with me, Chairman. So we will be doing training on these three policies for both officers and members, and just working out a nice, exciting way to take you through these policies so that we keep you enlightened as we take you through them. But we absolutely will work on that.
Thank you.
Oh, something there for you to look forward to, Judy.
Absolutely.
Okay, any other questions? No. Okay, James, so over to you for the roll call.
Yes, Chairman. Councillor Copplestone, are you for the proposal?
4, please, James. Thanks.
Councillor Emsall?
4.
Councillor Hempsall?
4.
Councillor Leggett?
4.
Councillor Mancini Boyle?
4.
Councillor Vincent?
4.
And Councillor Wymark?
4.
That's carried unanimously, Chairman.
Thank you, James. Okay, so that moves us on then to page 279, being the Plumstead Road proposed compulsory purchase order. Over to you, Director Courtier.
Thank you very much, Chair. You'll have read the report. It is self-explanatory. This is a key piece of infrastructure which we want to see delivered. We wanted to do that through the normal procedures. We have funding to deliver it. It needs a section 278, which all the landowners need to sign. And to date, we haven't had the signatures of the key landowners to the south of the site. Therefore, as the recommendation states, that we will continue to try to engage with the landowners to get them to sign the section 278, but in parallel, seeking council's authority to progress a compulsory purchase order if that is required as a backstop. Thank you very much, Chair.
Okay, thank you for that, Phil. Lana, did you want to say anything at this point?
Yes, thank you, Chairman. Yes, Director Courtier is succinct as ever. I think what I'd like to draw members' attention to is on page 288, the recommendations. I think I am personally only in favour of compulsory purchase orders when they are absolutely necessary. However, when members have read the report, this piece of infrastructure is key. Delivering it in a timely fashion is supported by funding that may run out if we run out of time. Local authorities and authorities in general are criticised often for not taking decisive action, and I feel this paper and continuing in this fashion definitely puts the mark in the sand that we are taking that decisive action. We are communicating regularly with the landowners involved, and we are taking this action to deliver this roundabout, which is really important in, not just, I mean, the wards affected are the Thorpe wards, but I think the wider impact is on all of Broadland and Norfolk, actually. So I'm going to recommend that you endorse, well, that you recommend to Cabinet the recommendations on page 288 in that order, because I think that order is important. We continue negotiations, and only when they fail do we have to revert to the CPO, which we're developing in tandem and in parallel. So thank you, Chairman.
Okay, thank you for that, Lana. Are there any questions on this one? No. You mentioned there about the funding, Phil. I think it's about 1.3 million, isn't it, roughly, that we would potentially lose?
Yeah, it's broken down on page 281 of your reports, and yes, it is certainly over it. It's about, I can't remember what you just said. It's about 1.3 million. Yes.
Yeah. No, thank you for directing me for where the breakdown is. Yeah, it's a sizable chunk. So, and as you said before, this is an important piece of infrastructure for the area, and as part of delivering the link road that will join the airport to the Broadland Industrial or Broadland Business Park. Okay.
Can I just make, sorry, Chairman,
yes,
can I just come in? Sorry, I mean, the council have, and the report highlights this, it's very important to know that we have turned around and looked at so many different options of different things that we could put in place instead of a roundabout, and it still turns out that the roundabout is that key piece that is missing. So it's not like we've just gone in and demanded that this is important to us. We have tried every other option, and we've developed this plan together with Norfolk County Council. So who will hopefully, in due course, now that we're taking this along this line, we'll get to the point where we can sign the 278 agreement sooner rather than later. Thank you.
Okay, so we have that recommendation before us. I'll second that. So over to the roll call, James.
Yes, Chairman. Councillor Copplestone, are you in favour of this?
For, please. Thank you.
Councillor Emsell?
For.
Councillor Hempsall?
For.
Councillor Leggett?
For.
Councillor Mancini-Boyle?
For.
Councillor Vincent?
For.
And Councillor Wymark?
For.
Thank you. That's carried unanimously, Chairman.
Thank you for that, James. Okay, so that moves us on then to the Public Sector Equity Duty Annual Report, which starts on page 332 and is in the supplementary papers that were sent out to us. I believe Sue is speaking to this. Yeah, I can see you. So over to you, Sue. Good evening to you.
Good evening. Thanks, Chairman. Right, members will be aware that we have a statutory requirement to report annually on how we've complied with our obligations under the Public Sector Equality Duty as is required by the Equality Act. We're required to publish our annual report on our public website. As you'll see at point 3.1, since the collaboration, Broadland District Council and South Norfolk Council have reported jointly on their shared equalities work. During 2020, the responsibility for equalities at the two councils was passed from the policy team to the governance team, which now oversees all equalities work. So we've provided examples of how we've complied with our duty by providing case studies and examples of where we've complied with the Act. Turning now to the annual report, which is at Appendix A, which I think is page 335 of your papers. This report demonstrates just some of the ways in which the councils have met with their requirements under the Act, and we've done that by showcasing policies and processes, and also by detailing individual cases where we've taken steps to go beyond our normal processes to ensure that equalities are at the centre of the work we do. On page 336 of the agenda, you'll see the list of 9 characteristics which are protected under the Equalities Act. And you'll also see that we have 3 responsibilities which we're required to report on relating to these duties. These are to eliminate unlawful discrimination, harassment and victimisation and other conduct prohibited by the Act, to advance equality of opportunity between people who share a protected characteristic and people who don't, and to foster good relations between people who share a protected characteristic and those who don't. We need to report and provide examples of how we've met these 3 points for our service users and also for our staff. You'll see that the report explores each of these in turn, firstly providing evidence of how we've met these for our residents, and secondly, how we've met them for our staff. And on page 346, you'll see how we're looking ahead to how we'll continue to meet our duty during the next year and some of the things we'll be bringing to you in next year's report. You may be aware that at South Norfolk Council Cabinet yesterday, we were asked to add in some figures to the report to show numbers on things like disabled facilities grants and numbers of calls to the hub. So I'm going to add these in the next few days. Therefore, I'd like to request that if you're minded to approve this report as it stands today, then these final minor additions can be signed off by the relevant AD in consultation with the portfolio holder. I would, however, like to point out that our duty under the Equalities Act requires the councils to give due consideration to equalities in the way we form our policies, how we treat one another, and how we make our decisions. And I believe the report before you today gives sound examples and evidence of this. Thank you, Chairman. I'm happy to answer any questions.
Okay, thank you for that, Sue. Jonathan, did you want to add anything at this point?
I was just going to say thanks to Sue for obviously putting the report together. It is a very good report. It does highlight the success we have in making sure that we follow the statutory duty. And I've obviously put the recommendation forward if there's no further questions.
Okay, thank you for that, Jonathan. I think Lana, you wanted to come in?
Yes, Chairman, and I want to thank the officers and the portfolio holder for this report. I think, I believe in my personal experience, the culture of this organisation and the members and the staff is reflected daily in the way that we treat one another and our residents, and I hope amongst the staff as well. From personal point of view, I've been treated with nothing but respect and kindness whenever my needs have been slightly extraordinary to other members. So I just want to thank you all in this room for that today.
Okay, thank you for that, Lana. Are there any other questions? No, I'd just like to again reiterate or support what Lana said around thanking the officers for pulling this together. There's a lot of information here, which is positive to see, and seeing the way in which the policies are being implemented. There was an element there of we're not quite there with the report that was going to be delegated to you, Jonathan, as the portfolio holder to sign off, or in consultation with you to sign off. Is that okay to add that to the recommendation, both from Jonathan's point of view and James? Did you pick that up?
I've got that, Chairman. Yes.
Yeah,
so
I think
okay
any additional data that goes to highlight the work that we do is always a positive. I think with that, you can say we do this, but then if you can say we do this and this is how many we have done, I think it is a positive sort of step. So it's not just talking about it, it's talking about what you've actually done. So yeah, that's all good stuff.
Okay, thank you for that. So we need a vote on this one, James. So over to you.
Yes, Councillor Copplestone.
4, please.
Councillor Emsall.
4.
Councillor Hempsall.
4.
Councillor Leggett.
4.
Councillor Mancini Boyle.
4.
Councillor Vincent.
4.
And Councillor Weinmark.
4.
That's carried unanimously, Chairman.
Okay, so thank you.
As amended.
Thank you, James. Thank you for that. Okay, that moves us on then to item 17. I move that the press and public be excluded from the meeting for the remaining items of business, because otherwise information which is exempt information by virtue of paragraph 3 of part 1 of Schedule 12A of the Local Government Act 1972, as amended by the Local Government Access to Information Variation